Hello, this is Dr. Keith Newby with Fort Norfolk Medical and the James E. Newby Jr. Foundation, and I am your voice of medicine here in Hampton Roads. I want to read an article for you today that I uncovered recently, and the title is, Can Weight Loss Help Ease Knee Pain? Well, currently we know there's no cure for osteoarthritis. However, some steps can be taken to manage the disease and improve the outcome. One of the most important steps is keeping a healthy body weight, and people should maintain a healthy body weight for many reasons, but the protection of the knee joints is one of them. Now, we do know that the Arthritis Foundation is saying that 1 in 5 Americans have been diagnosed with arthritis, and among obese people the rate is 1 in 3. So what is osteoarthritis? Well, essentially that's a breakdown of cartilage. Cartilage is that lining of tissue that connects the bone to bone that creates a joint. So that's the piece of tissue that kind of helps to keep the joints moving smoothly so that you're able to bend and move and carry on activities without having a whole bunch of pain. Well, in osteoarthritis, that cartilage starts to degenerate and can lead to multiple problems to include pain and suffering. Now, how does osteoarthritis develop? Well, the first is through forces acting upon the joints, and the second is through an increase in inflammation. This increase can affect how muscles work and how sensitive nerve endings are. Inflammation leads to increase in pain. So fat is considered an active tissue. It creates and releases chemicals within the body that can promote inflammation, and these chemicals can influence the development of osteoarthritis. Body weight directly influences both pathways. Obesity not only raises the risk of developing arthritis, but it makes arthritis worse. And interestingly, and this is why I wanted to bring this up, the Arthritis Foundation states that 1 pound of excess weight exerts about 4 pounds of extra pressure on the knees. So if someone is overweight by 10 pounds, they have an extra 40 pounds of pressure on their knees. And being overweight also puts extra stress on the joints. Extra stress makes the joints more likely to wear down and become damaged. So the stress and damage are especially apparent in weight-bearing joints such as the knees and hips. So losing weight helps ease knee pain. Some people have difficulty exercising because they have arthritis and they are in so much pain. But I would just suggest that there are other things that can be done to get the exercise in that won't increase stress in the joints, such as swimming, biking, which oftentimes will allow the person to be a little bit more mobile because you're not putting stress on the knees by biking. Of course, water, because it's a low impact activity or exercise, may be better in certain circumstances because really there's almost no weight bearing when you're swimming, and you can keep your legs straight as you're swimming, and that will assist with the pain and inflammation that occurs from bending the knees. And it is, again, low impact. It's just a matter of getting to a pool or getting somewhere to be able to do it, but it has been shown to be extremely helpful in people with arthritis. So I want to bring that up just so you understand the severity of the problem and how obesity can impact the development of arthritis. So again, remember that 1 pound of extra weight, 4 pounds of extra pressure on the joint. So that's a profound statement. I think you need to hear that. So again, Dr. Keith Newby, Fort Norfolk Medical. I hope this information is helpful to you. Again, you can email me if you have questions or concerns. drnewby@yahoo.com. That's dr.newby@yahoo.com. It's always a pleasure seeing you again, and I hope to hear from you soon via email. And please send me your comments. And anything else I can do, please let me know. God bless. Take care.